Words I never expected to hear. I was told that I have breast cancer.
Wow. In this morning's health check, a bombshell announcement from ABC anchor Amy Robach. At the age of 40, the media personality underwent a mammogram as part of a piece for Good Morning America, and now she is recovering after undergoing a double mastectomy. Here with more on the process of breast reconstruction after such surgeries is plastic and reconstructive surgeon Dr. Young Cho. Thank you so much for joining us this morning.
Good morning.
Boy, that is a life-changing diagnosis, and certainly after her diagnosis, we want to shed a little light on breast reconstructive type surgeries here. Tell us, those who may be facing that, what should they know?
That's a wonderful question, and I do applaud Amy for sharing her story with the rest of the country. When someone comes in and tells me they have breast cancer and they're planning to have a portion or all of their breast removed, or in this case, both breasts removed, there are several considerations that I tell them during the consultation process. The first is really what size and shape is the desirable outcome after we do the breast reconstruction. The second would be the timing of the reconstructive procedure, and the third would really be the type of reconstruction that we're planning. To address the first point, in terms of the size and shape, some women are very comfortable with the existing breast size they have, so we use the opposite breast to guide our reconstructive process. If they say, I'm much larger than I ever wanted to be, can we make it smaller? Then we're often planning a second symmetry procedure on the opposite breast to reduce the size once the desired breast mound is reconstructed. Conversely, if they're smaller, we're making them bigger on the opposite side.
So a lot to consider there. And, you know, breast reconstruction is certainly physical, but it can definitely be an emotional process.
Absolutely. It's a very emotional process because you're dealing with two aspects. One is, am I going to die? The fear of going through breast cancer and all the different treatment options, and it's really about their own safety. The second part, once they have a deeper understanding of what the prognosis is and so forth, they're really looking at, well, what about my self-image? What about my self-esteem? What can I do to think about breast reconstruction so that I don't have a constant reminder that I've had breast cancer?
Right, and your personal advice, you see a lot of women, and obviously you hear their stories. Your personal advice for women who may be facing this type of procedure?
The biggest thing I would say is to include a plastic surgeon as early on in the process as possible. The timing, which we touched on earlier, can make a big difference. If the woman is a right candidate to have an immediate breast reconstruction at the time of removal of their breast, then they can wake up with an intact breast mound and shape, and therefore the impact on their self-esteem is greatly diminished. So our ability as plastic surgeons to help consult with the woman and help them decide, is it the appropriate time and the type of reconstruction that we may be planning, is certainly easier to do ahead of the actual surgery.
Thank you so much for joining us here. As we mentioned, life-changing diagnosis, and there are ways, as you mentioned, to sort of make it just a little easier, the transition. Thank you so much, Dr. Cho, for joining us.
It's a pleasure to be here.